Hi, it's Mr. and Mrs. Scott.
Yes.
Hi, yeah.
Hi, I'm Chloe Macaulay. I'm one of the baby doctors.
Hi, nice to meet you.
Congratulations, I understand you've just had your first baby, is that right?
Yes.
Yes.
Yeah.
Okay, how are you feeling?
Happy, although these people have been in and out, so
Yeah.
we're a bit on edge and a bit confused. What's
Okay,
happening.
okay.
Worried.
Well, that's why I've come to talk to you.
Yeah.
Okay.
Tell me what you understand so far. What have people said to you?
Well, basically, after my wife gave birth a few hours ago, they told us the baby was healthy, but they couldn't decide whether it was a girl or boy.
Okay.
And no one really said anything, and they're just whispering, and
Okay.
we're just confused.
Okay, well, what you say is absolutely right, and I'm sorry that you feel confused, but sometimes at the beginning things aren't clear and we need a bit of time to sort
Okay.
things out. So that's what we intend to do over the next few hours and days.
Okay.
So I've actually been to see your baby myself. As you say, lots of people whisking in and out, and sometimes when babies are born you can't be certain what sex the baby is, and it's really important not to say one thing and then be wrong.
Okay.
In lots of cases, what you see is, when you look in a baby's nappy, you see something which you're not sure is either a kind of very swollen vagina, very swollen clitoris, or a very small penis. And that's the case with your baby. Okay? So it may be that in 24 hours, the swelling has subsided and it's very clear that the baby's one sex or another, but for now, we can't be sure.
Wait, so you're saying there's something wrong with our baby?
Yeah.
I'm not
So-
saying that. I'm not saying there's something
What's-
wrong. I'm saying there is potentially a cause for making the fact that your baby's genitalia don't look normal. Okay? So
Okay.
what we need to do is we need to do various tests in order to get to the bottom of it. Okay? So the first thing I want to say is it may be that every single test we do is normal, and tomorrow when we look at the baby we can say, oh, this is clearly, this is looking much more like a boy or much more like a girl, and we'd still like those tests to reassure us, but
Okay.
it might be that there's nothing wrong at all. Okay? The test that we do is we'll do some tests looking at the baby's genes, so to see whether the genes are the genes of a baby girl or a
Okay.
baby boy.
Right.
That's one of the tests that we'll do. And then we'll also do some other blood tests looking at some other salt levels in the blood, because they can sometimes be abnormal.
Okay. You say gene tests.
Okay.
Does that mean it's our fault?
It's a very good question, and no, it definitely isn't your fault. Okay.
Okay.
The commonest cause for us seeing this, although it is very uncommon, the commonest cause is a hormone problem, which we can pick up on a blood test. Okay, so that's why we want to do a blood test.
Is it something you can manage, or is it something lifelong? I mean, what does that mean?
I can understand that you've got loads of questions,
Yes.
and it's a time of great uncertainty. What we can do is, we don't know, and I don't want to start talking in great detail about the different possibilities until we know what it is. So what we're going to do is we're going to do 2 tests in the immediate term, and that's to see whether the baby has got chromosomes of a boy or chromosomes of a girl. That's the genes of a boy or the genes of a girl.
Okay.
So we know what their genetic makeup is.
Yeah.
And we'll do this other test looking for this hormone problem. And they will give us a lot of information in the first instance. And then we will take it from there, thinking about, what, if anything, we need to do. So as I say, it may be that your baby's totally normal.
Okay.
Okay.
If they have one of these hormone problems, that is something that we can treat very easily.
Okay. So what are we going to do now? Because our relatives keep coming in and they're like, what's his name?
So I think the best way to approach it is to just say, sometimes it's not clear, and it may become clearer, and they're just going to do some tests.
Okay. Are the tests going to hurt the baby?
So the test that we're going to do in the first instance is a blood test. So that's
Right.
just a prick with a needle, and babies at this age aren't normally bothered by blood tests. And then after that, we might go on in the next few days to do some more tests, but I can talk about those if and when we need to do them.
Okay.
This is quite overwhelming.
A bit of a shock, really, I think. wasn't expecting.
Will we be able to talk to some more people later on? Because I'm sure I have a lot of things going through my head that I'd like to.
Sure. Well, I can leave you now just to kind of get your head around it, because I know that it's a lot to think about. But the essence of it is, and I can just go over it again in simple terms, if you like, is that we can't be sure what sex your baby is. This sometimes happens, and it sometimes turns out to be nothing. Okay. Occasionally, and the commonest and most urgent thing for us to work out is if it's a hormone problem. So that's why we're doing the blood tests.
Okay.
And we're also doing some genetic tests to look at what genetic sex the baby is. So if the baby's got the chromosomes of a girl or a boy. Okay. So they will help us. So we'll have much more information in a day or two, but we won't get those tests back straight away because it takes a bit of time. And so just for now, if you can bear to, it's just better if, of course, you can have the baby with you and you can start bonding with the baby and introduce the baby to everyone, but just we can't be sure at the moment. And I know that's difficult, but we will know in the next few days.
But the baby is okay?
The baby is fine, and whatever it is, we'll get to the bottom of it.
Okay, I feel a bit better now.
Yeah.
Okay, at least it's okay.
Is there anything else you want to ask?
No.
Not at the moment. We'll have a lot of questions.
Well, I'll
later.
come back. I'll come back in about an hour or two, and we can talk about it again if you want. If there's some more questions that come to mind.
Okay, thank you.
Of course.
Okay.
Thank you.